Hello everyone, hope you all are doing well. Welcome to this webinar. I am Bhavna, Director of Marketing Partnerships at Rehab Path India. We are a Madison-based startup with the mission to help patients and families struggling with addiction and mental well-being by connecting them to the right treatment centers. We work with around 2,000 plus treatment centers in India. In today's webinar, we'll be discussing rural mental health with Healstation Foundation, and our guest speakers are Dr. Gaurav and Snehal Joshi, co-founders of Healstation Foundation. Rajnandini, who is psychologist and is also a part of our team, she'll be driving rest of the conversation today. This is going to be about an hour of session, and feel free to drop your questions anytime on FB or Zoom. We'll take them at the end of the session. Over to you, Rajnandini.
Thanks, Bhavna. Again, I'd like to welcome you, Gaurav and Snehal, to our call today. And I've heard a little bit about you. I've looked through your website, and so I'm very excited to have this conversation with you. So before we go ahead into our topic and talk about the mental health in rural India, could you give a short introduction about yourself?
Snehal, you want to go ahead first?
Sure. As Bhavna said, I am Snehal, and by education, I'm an engineer. I have worked in IT for 10 years with Infosys. But in 2016, I quit my job, and I and Dr. Gaurav together co-founded something named as Healstation, as in HEAL, Healstation. We started a small hospital in Ramnagar, which is on Indo-Nepal border of Bihar. It's in West Champaran. So we started that hospital, and we started getting a lot of different kinds of patients who were suffering from physical health issues, emergencies, and also a lot of people with mental health issues. But that time, we both were not equipped to handle that. So we both did a postgraduate diploma in mental health from Christian Medical College, Rathod. And that's when we started our charitable foundation in 2019. Through this, our sole, I think, purpose of creating that foundation was to work in rural mental health. That's how our journey started with Healstation Foundation. And I mean, given that I have done engineering, and after that I have done a postgraduate diploma in mental health. So as in to be a mental health worker, after that my mental health journey started. Currently I'm pursuing masters in psychology, but that has been pretty much my relevant introduction, I would say.
Sounds amazing. Okay, Dr. Gaurav, you can go.
Yes. I am a doctor. So I've done my MBBS, and followed by that a lot of other things, and then I ended up doing a diploma in mental health from CMC Vellore. And so, as Snehal said, that we started Healstation, and we started working here in West Champaran district of Bihar. So yeah, so we run a community mental health program here, and that takes most of my time. Yeah.
Okay, that's great. I have so many questions coming up in my head, but before I ask you those questions, let me ask you to introduce Healstation to us a little bit, to understand what kind of work you do at Healstation.
Sure. So when we started Healstation, as I said, our purpose was to work in mental health. But what happened was COVID was very prominent that time. So if I want to say the Healstation Foundation journey, we started just going in the villages first, and just getting, because if you know that there is this Valmiki Tiger Reserve that is there in West Champaran, which is a huge jungle, which is connected to the Chitwan Park in Nepal. So it's a huge border jungle area. So obviously around the jungle, there are tribal population there. So we started going to the villages, we started helping with the COVID things and all. Then we got to know a lot of other problems. So we started working on the food security, etc. And then we started our mental health program in one village. which was 100 houses village. So we did the survey, we found the patients. Nobody came to our clinic. We terribly failed at it. And then we redid the program there. This time patients came, everything happened really well, but patients did not stick long. Like they started taking medicines and we started giving group therapies, and it kind of, we had to wind up everything in 2 months because the patients did not come for follow-up. Then we made few more mistakes, and then finally we started doing this program through the entry of school mental health. We did one program of school mental health where we went and taught those children about mental health. And it was a very fun interactive program. And after that, we actually got entry into the tribal population, because they kind of started then trusting us a little bit, because it's very hard for them due to the history of oppression, very hard for them to trust outsiders who have come with no purpose but to help. That is also a little bit of problem. So we struggled with that. But after 6 months, I think things started getting better and better. So currently, Healstation Foundation is running this rural mental health program in almost 31 villages. Like it's one whole panchayat, around more than 35,000 population. And we have a great team of women who run this program. Yeah, I mean, currently we have more than like 100 plus patients, and we are expanding, and we keep resurveying the villages for the newer patients, and we do that. So mental health, rural mental health is a big part of Healstation Foundation. But as we progressed, Nandini, what happened was we started to interact with women in the villages, girls, young girls in the villages. So we saw the need of digital education there, computer education, because there was like girls usually won't be sent to cities to learn computers, etc. And we thought it's such an essential skill now. It's a life skill now, like knowing computers and smart devices. So we opened a small digital Dosti center there where we teach girls computer for free. Then our girls started one program which they were passionate about. It was a tailoring institute. It was started by our team of girls who were working on the ground, like our mental health workers. They started to teach women who were not able to go to school but wanted to learn those skills. So that Sui Dhaga program is there. And when we were doing mental health, we realized that a lot of women go through unnecessary hysterectomies, which is removal of the uterus and ovaries. So a lot of women were going through a lot of mental health issues, and because of that, and that percentage was very shocking. Like in every village there, we used to find at least 5 to 10 women who have gone through that, which is a huge number. And you can imagine, and we were like shocked. So we started this menstrual hygiene program named Red Revolution, where we go and not just distribute pads. We give them eco-friendly cloth pad, but along with that, we empower them with knowledge, like how the menstruation happens and why this kind of surgeries are not advised. And if you want to do them, then where to get tested and what are the proper ways to do it, and how to maintain hygiene to avoid infections, because that is the fear that they have. So I think these are 4 major programs. And other than that, whenever there are floods, there's a fire, there's a natural or man-made disaster in jungles at times. So we pitch in there as well. So these are like 5 things we do.
That's a lot of things. And
a bit of long answer, sorry.
Yeah, no, but it's amazing. I mean, I'm sure you haven't told me the details of any of these. It's very brief, but yet I'm very inspired that you kept going even though you faced so many hurdles in the beginning, right? And what I understand from this answer is that you can't go in with one plan and see that you're going to address all of these problems, because you don't know what are the problems that they're facing. And in your journey, you've seen what the problems are and addressed them immediately. I think that's the kind of approach that we really need in places like this. Is there something that you would like to add, Dr. Gaurav?
I think Snehal said most of the things. Other than that, there's one more thing we do is that like there are some families who don't get enough food for themselves. So I think there are approximately 90 families. So we support them with all the rice and dal and oil and things like that. And we keep looking for such people as well. That hunger is a very bad thing. So I think whenever, wherever, whatever, and how much ever we can do, we try and do that. So that finishes, I think, most of the things that we do. Yeah.
Okay. I have so many questions, like I said, of my own. So before we talk about mental health and how it is in rural areas, what really inspired you to go ahead in this area of work, and what motivated you throughout the whole process?
Okay. So there's a small story behind that. Like when we had started working here, it was some time that we were working here, and then we thought that we've come here, we should see the jungle and the people there and all that. So we thought we'll go there. So we started going and we started visiting various villages and all. So there was this one village, like after crossing 2 jungles, after that there was one village. So we went there, we were sitting in the, like, where there's always this big tree in villages. So we were sitting there with other people and talking. And suddenly we saw that there was one person walking from a distance, and he was walking with he was walking with a lot of difficulty. When he came closer, we saw that his feet were chained, and he was a young boy. And at first, like, we felt that what is this? This is really wrong.
Right.
And we felt a lot of anger. But then we started asking people, what's wrong with him? Why is it done like that? So then people told us that because that village was situated inside a jungle, and that kid had this problem that he used to run away to the jungle. And both mother and father, they used to work in the field, so there was no one at home to take care of him. So, and when he goes in the jungle, there are dangerous animals in the jungle, and of course it's a huge jungle, so for them to go and find him in the jungle is again a very difficult thing to do, and it's dangerous for that kid as well. So that's why, out of concern and care, his parents used to tie his feet and keep him so that he can't go too away in the jungle, right? So then we understood, and we felt so bad about it. And he had mental retardation along with psychosis, so and seizures. So he had all these 3 things. So we saw that, and at that time we did not know how to help him because it was too far. We knew very little, and we did not know how to go about it so that we can take care of him completely. So that is something that we always had in our mind, that we want to help such people who do not get help from anyone, and people who do not know that they need help. So and that kept us going, that okay, fine, we have to untangle his chains, and that's how we started. Yeah.
Okay, that's a very, very inspiring story. And generally people might just see something and then move on, but it's really nice that you are taking the initiative to help all these people in every way that you can. Okay, so since you've been working in this field, you can educate me and a lot of our listeners on what it is like, what the situation is like in rural areas, whether they have help, what they know about mental health. So my first question is, what is the prevalence of mental illnesses like in rural areas, and do people understand that this is a mental illness? Snehal, you're on mute. Yeah.
Do you want to take up the prevalence question, Gaurav?
Yeah. So like how National Mental Health Survey says that prevalence is around 10%, and most of those people do not get treated. So like they say that it's somewhere between 72% and some 93-4%. Those people do not get treated. Okay. So that is what National Mental Health Survey says. Then there are other surveys also that say that, Prevalence specifically in rural area is around 30% for common mental disorders like depression and anxiety and OCD, etc. So that's but what we have seen, we have still not been able to find all those patients, and that struggle and that fight is still going on. We probably are just scratching at the surface, and we are finding people, obvious patients we probably get to see, and so that's how it is. And like surprisingly or not so surprisingly, prevalence in rural area as well as in urban area, it's almost the same. In fact, prevalence in any population anywhere in the world of mental illnesses is the same. So yeah.
So, I mean, to add to that point, like Nandini, we all think that, oh, those people in the villages, they love the nature. They have such beautiful scenery when they wake up. How can they have depression? And that is the common question that we have been asked always. Because that's the thing that I think we lack. We don't understand the luxuries of life that we get, and they have this basic struggle of life. That is not having access to healthcare, not having access to education, good education. Then there is also all these climate changes going on, which is kind of playing with their agricultural cycle. So there are a lot of things on daily basis they are also going through, despite of being in the nature and etc. And that plays, mental health issue is a multi-dimensional issue. It's not a single dimensional issue that you start living near the nature and your depression will go away. That doesn't happen, right? So, this myth is there that rural people are very resilient, and I agree that they are resilient, but then their problems are also huge. Like we had these 10 families who lost their home overnight because of the fire, and the fire was not due to man-made fire. It was because of the heat, and they lost almost everything. So imagine, those kind of issues people are dealing with on daily basis. That struggle is also real. So that's why the prevalence, you don't see a difference. It's not high or it's not low. It's same as in any other population.
Okay, makes sense. I think you brought up a really good point, that mental illnesses don't really discriminate, whether you're in a rural area or you're in an urban area, whether you're in India or in some other country. Anyone can have a mental illness. And like Snehal mentioned, there are many, many factors that can cause mental illnesses. So I think prevalence might be the same, but the number of people that approach or get treatment must be different. So my question is, what kind of treatment options or resources are available to people in villages? Let's say someone recognizes that, okay, maybe this is a mental illness. What kind of resources do they have?
So before I answer that question, like we are looking at a spectrum of mental health disorders. So we are talking about severe mental disorders like psychosis or like schizophrenia, bipolar disorders. We are also talking about depression, anxiety, the common mental disorders like OCD, etc. Then we are also talking about children with intellectual disability, autism, learning disabilities. Then we are also talking a little bit about neuro problems like epilepsy, which goes untreated. So we are looking at a broad spectrum. The interesting thing to know would be that depression, anxiety looks a bit different in rural. That is our observation. I'm not giving you the research data here, but that is our observation. That it looks very different. It'll come in the, I don't want to use psychology terms, but somatic forms, and like it will show as a physical symptom more than it will show as a mental health symptoms. So you won't say somebody, let's say, sitting and crying and being sad, but it will be reflected as more of recurrent back pains or not being able to function properly or those kind of. That's what we have learned. So there is a bit of difference how you see mental health in rural, like how it looks to the eye when we are learning. So that is one thing. Second thing is, now we are talking about real issues, is what do they do if they know the problem? First of all, they do not know that there is a problem. Like a lot of us do not know. That is because of the lack of knowledge that we have about mental health. We don't consider this as a real illness everywhere. Now, once they know at least there is a problem, the first thing that comes because of their religious, magical religious beliefs and that kind of background, that first they'll go for, in Hindi we call jhad food. So basically they think that it is due to black magic, particularly the psychosis and personality disorders, bipolar kind of thing, where mania and all is there. They would think that it is due to some black magic or demon possession or something. That is their model. So first of all, they would go for that. Most of them would go for that. And how do we know that? From our school mental health program, we ask this question: if you have this issue, where will you go? Most of the kids will take him to the local, some Baba or some mantrik there and some healer, you know. So that is their first intuition. Where do they go? Secondly, sometimes they do go to the general practitioners, or they will go to a quack in the village. Okay, if quack in the village is not able to do anything, they will go to the general physician. And if we are talking about rural scenario, in our area at least, the nearest mental health, I would say psychiatrist, is accessible 150 kilometers away. That is Gorakhpur, which is the nearest big city, and in Patna, which is 250 kilometers away. So that's the first point of access that they have. If they really want to seek help, they have to travel that much and go. So follow-up becomes a very difficult thing there. So first issue is not having knowledge. Second is that they have this magical religious belief that is their model. They go in that. And third thing is that they don't have access to, even if they know where to go. It's not an easy access. So these three are like major issues, how they look at mental health. Now, another thing to look at mental health is most of the times, when we have spoken to a person, especially with common mental disorders like depression, anxiety, the common myth that exists, I think, in urban and rural both, is that it's a weakness of mind. And it is often seen as that. We see a lot of women with anxiety issues, which come across as recurrent headaches, backaches, and mostly physical symptoms, but underlying there is mixed depression, anxiety. And that is also seen as a little bit of drama by other family members at times, attention seeking behavior kind of. So it's mostly brushed under the carpet, saying that she's not getting enough attention, so she's doing it for attention. So that is also a common thing that we've observed. But now when we have worked in those villages for 2-3 years, we see a little bit of shift. Again, why I'm using the word little bit is because it's a humongous task to bring that attitude change in people. But now we see that if somebody has similar issue that we have treated and gotten better, they will get in touch with our team and us. That is one thing I think we have seen. So Gaurav, would you like to add to this?
I think there are two things. One thing is that probably a lot of people do not have knowledge about various mental illnesses that can be there.
Right.
But they have, especially I do not know about other areas, but in this area, in this tribal population, I have seen that they have they have a lot of help-seeking attitude is there in them. That's why they have been going to these Babas also, right? They're going there because they want to get better. So I think that was a very good thing that we found, that they want to take help. It's just that they do not know what is it and where to go to. So I think when we went out and we started doing screening and we started looking for people, I think we found people who were untreated for 20 years, 25 years with schizophrenia, 20 years with seizure disorder, and so on and so forth. We have found adult people with mental retardation also. So you can imagine, they have spent 20 years with that, and then with that there are comorbidities. So I think they did not know what to do. So that is, I think, is one of the big problems here. Yeah.
I mean, just to end with that, like a lot of times we see what is the problem with them, but the problem is from our side as well, that help and that knowledge is not spread enough over the years. So I think the responsibility lies on both sides.
Absolutely. I think from what you've said, it seems like since people in rural areas tend to be more collectivistic and more dependent on each other for their day-to-day lives, they're more okay seeking help, and it's not seen as a weakness, which might be the case in urban areas. Plus, I think a major problem here is the lack of resources because, like you said, a psychiatrist is probably 150 or 250 kilometers away, which is a long journey, which is probably equivalent to missing 1 day of work and 1 day of wage. So a lot of people might not even be able to afford to do that. So there are a lot of factors, of course, but as we increasing the number of resources is definitely important. Uh, it's really, I'm really happy for the people in the village that you're working in, at least that they do have some help available for them, right? So when we're talking about people in rural areas, how is their attitude towards mental illnesses? Like you said, you've done some awareness programs in schools as well. So what was their attitudes or beliefs about mental illnesses? Do you see the stigma? Like we see stigma even in urban areas and even in our day-to-day life, even in metro cities, you'll see a lot of people have a lot of stigma towards mental illnesses. So is that also there in rural areas, or is it different in any form?
Like in contrast to how you see in urban areas or a little developed areas, I think surprisingly we did not find a lot of stigma here. So in our villages, like, see, for the first thing is that they did not know what's happening. To have stigma, you have to know something, right? You have to know something, then you have to make something around that, that you gain misinformation from other places, and then stigma is probably, that's how stigma is built. So here we did not find a lot of stigma, and in fact, earlier when we had started, we used to do our clinics. We do clinics in the community, right? So we go to the villages, and we used to find, like, wherever the patient is coming and talking to me or Snehal. So we used to make that place a private area there only. That it has some distance from the other people who are sitting. So that's how we used to do clinics, because we thought that they need privacy to talk about their issues. But that's how we did. One day we did not find any private place, so we did our clinic out in the open with everyone. Okay. And there we realized that everyone started talking about that patient, because everyone in the village, they know about everyone. So they started telling कि अरे नहीं ऐसे नहीं होता था उसको, वो ऐसे करता था, or he runs from here to there and he keeps running, something like that. So people started contributing to that. Another thing what happened was that the people who got better, they started telling that I also had gone to that Baba for Jhatpuk, and it didn't do anything. These people gave me just one medicine and I'm doing so well. So all of them, they became co-therapists there for that patient, so, and their families. So I think if stigma would have been there, nobody would have talked about it, right? Yeah. So, and then since then, we've been doing our clinics out in the open. So we don't look for a private space. If somebody wants to talk something, we take them somewhere and we speak to them. But otherwise, all the clinics are done there in front of everyone. Yeah.
Like Gaurav said, yeah. Like especially the patients with ID and psychosis, we haven't seen abandonment issues by family. Oh. Like there might be like issues because lack of nutrition, etc. But as we saw that example also where the boy was chained, it was really out of concern by the parents. So as you said, tribals are very collectivistic and very family oriented people, and they live together, and but So they have that. So we didn't see that kind of stigma where people were abandoned on road with psychosis. And in fact, we had a village calling us that somebody has wandered from some other state and have come to us and seem to have a issue that you guys work on. So they called us to see that patient. So get it? So it's like that kind of stigma is not there when we say. With common mental disorders, as I said, that it's not, it's looked upon, down upon a little bit too as a, kind of drama and not real illness kind of thing, because it takes also long to get cured, right? It goes on for a longer period and it's hard to treat. So the progress is really slow. So that's why, but that is, I think, something, that kind of stigma is easier to fight with kind of psychoeducation, talking about how the anxiety looks and why anxiety is there, and by educating them, that stigma can be handled. But otherwise, this kind of social stigma, as Gaurav said, it's not there.
I'm actually surprised to hear that because I thought stigma is just there in every part of the world. But it makes sense now that you say it, because if they don't have any information about it, how would they have misinformation about it either, right? So I think that's a plus point, because having stigma again would be a very big additional hurdle to be able to do any kind of work over there. It's very interesting to know how contrasting it is when you look at urban areas versus when you look at rural areas. So while we're still comparing the two, how are urban and rural areas different in terms of their approach to mental health and wellness? Like today, if you look at Instagram or social media nowadays, if people are talking about wellness and self-care, it's always like skincare products and taking a day off to the spa or something like that. So are there ideas like that for mental health care or mental well-being that people in the villages also follow?
No.
I'll just say one thing, and probably then Snehal can take it over. That the difference between urban as well as rural and rural mental health, or like attitude of people towards it, I think there is one difference that I know of. Other than that, I think I don't have a lot of urban experience, so probably I can't talk about it. Probably Snehal can. But one thing that during COVID, we were helping a lot of people, and somehow people got to know that we are helping a lot of people. So we started getting calls from all over India. And I remember once we got a call from Mumbai, and there was a patient with psychosis in their home, and they wanted help with that. So we said, okay, fine, we can help. Probably, we can diagnose and we can think of what to prescribe, because psychosis, you need medicine for that, right? So we thought we'll prescribe it, and we will find any of our friends in Mumbai and we'll make them write a prescription for you. So we said that, and we prescribed. They were so adamant that no, we don't want medicine. So they had stigma of medicine, that we don't want medicine because once we start medicine, so probably that person will get addicted or something. And so there was a lot of stigma. So I know that this medicine ka stigma is there in cities a lot. And then since then, I've noticed quite a few times that people say, no, we don't want medicine, so something else. And but in villages, it's not like that. Whatever helps. So they're fine with it. So that is one difference I know of. Other things probably Snehal can tell.
In terms of self-care, I'll this first. I mean, there are a lot of differences, of course, and at the end, we all are human beings, so there is not a lot of difference also in the approach. as parents are worried for their intellectually disabled kid in cities also and in rural also. And, so those kind of basic human emotions, I think, are same everywhere. That's what I have observed. But in terms of self-care, I would say that we are going towards this holistic approach of giving yourself time, not getting burnt out, and taking breaks, or pursuing hobbies and all that kind of model. I would say that in different form it is available. It is done in rural, but it comes off more as celebrating festivals together, or I know the group of girls that work with us, that they would go on an evening walk together, because it's scary to go alone in the agricultural field, right? So they would take evening walk together and talk to each other about their day, and or anybody in the village, of course. So those kind of things that they do. I won't in terms of hobbies, they do have they make this all bamboo work is there, and lot of that I think crafting and all those things women do a lot there. So that is there. Men are into field games like football, cricket, and all those things are there. And their lifestyles are physically hectic lifestyles. We need to understand. So their self-care might look a bit different than us, but it is there because it's a human nature, right? To give yourself a break. So I think that happens, and naturally also due to agricultural cycles, I think they have those uptime where they have to work really hard, then they get a little bit of downtime where they can relax a bit. So they follow that kind of, like if there is too much of it, the girls would say, ma'am, we are not going for follow-up. We'll either go early in the morning or in the evening, but we are not going. So they know how to adjust with climate about their work and all. Like for us, that won't be an option, right? We work on the clock. We won't work around the nature and environment. So I think that comes naturally to them, very naturally to them. So also, sorry, go ahead, ma'am.
Yeah, maybe Snehal, like they are having their me time, but they don't know to call it their me time.
Yes.
Actually,
Yes.
they have something in their routines which is
Yes.
there, where
Yes.
they have to take care, but they don't know how we actually differentiate. Like, okay, this is my me
Yes.
time, this is my work time, this is my
Yes.
family time, this is my entertainment time or zone, something like that.
Right.
Yeah,
So,
you were saying something.
Yeah. I mean, I completely agree that they also do those things. It's just that nobody has put them on Instagram yet as self-care. I think I would say that it's not yet labeled that way. But yes, in terms of self-care and I think mental health maintenance, as we call, they do those things. But again, life is tough. So there are people who go into depression and have anxiety. But one more difference, you might find it odd for me to talk about, but is religious belief. It's a great coping skill, and that comes very handy in when we do therapy sessions with them. Because of the tremendous belief, it's very useful to use it as a tool to work on your mental health. So that difference also I see. A lot of us are almost confused whether are we religious, we are not religious, whether we believe in God, whether we do not. We are somewhere in between, always questioning, which is a good thing. I'm not saying it's a bad thing, but that issue I don't face. By default, people believe in God and they follow religious practice. So that also, rather than sometimes it hinders the growth, because then their medical model becomes distorted because they want to go to temple and do those things rather than seeking this kind of help. But once you break that barrier, it becomes a strength. So that is also a difference that I've also. I hope that answers the question, because I think I was all over the place with the answer.
No, it absolutely does. And I think what I understand is that it's very ingrained in our culture, self-care and prioritizing our mental health at times. Like Bhavna said, we might not know that it's our mental health that we're doing this for, but of course it helps, like celebrating festivals or socializing, going out on walks, always talking about your problems to people. So there are a lot of these things which definitely help people, and it's great that it's been part of our culture and it is that way. So when you began talking about Healstation, you started off with the kind of challenges and hurdles that you had to face right in the beginning, right? So is there anything that the government is doing to promote mental health initiatives in rural areas?
I mean, there is a national mental health program, right? And in a lot of places, they're doing good work. Like I know that it is doing really well. Like this program is running really well in Kerala. I know that they are working really hard to make it work in Telangana and Andhra. So I know some places where people are the system is really doing well as far as national mental health program is concerned, and it's a beautiful program. And if it is executed nicely, I think it can solve most, if not all, the problems that are there in the rural areas. But the thing is that it's a huge country, limited resources, so it'll take time. But I think that program, I see a lot of hope in that program. Right now, I don't see that program being run in our district. Probably I don't know, I can't comment whether it's running anywhere else in Bihar or not. But it's a beautiful program. And if you read it and you feel with so much of joy that, if this happens, all problems are solved. So, yeah, so that's what government intends to do. Yeah.
Can you briefly tell us about National Mental Health Program?
Yeah, so they have designed it like there will be one big center at the state capital level, and there will be centers at the district level. District level center will have psychiatrists and psychologists. From there on, when you go down to block level where there are primary health centers, they will upskill all the general practitioners, the medical officers who are working in the primary health centers. And so they will treat, there's a list of things that they will be able to treat there. And for other things, they'll refer it to the district level. But that's not all. So the PHC doctors, the primary health center doctors, from there are sub-centers everywhere, right? And there are these health workers in the villages, the ASHA workers and other health workers are there in the villages. So that program uses all of them. So the sub-centers also become a place where the screening is done. The ASHA workers who are in the community, they are also involved in the continuity of care and other things. And it's a beautiful, beautiful program. And if that is executed, because they already have a lot of things, they just need to probably upskill their health workforce, and they are working on it. Like NIMHANS is working on it, CMC Vellore is working on it. So all of them are working to create programs to upskill these medical officers as well as the people who will be working in sub-centers. So, yeah.
It sounds like a very multi-tiered approach, and also using all community resources, because we don't have enough resources. It's a very smart project. It would be, I'm also inspired, and I'm hoping that this does work, although I know it will take a long time. Snehal, would you want to add something?
No, I know, on paper, it is very beautiful. And it's something that we should all strive for. But it's not happening, is the fact. Otherwise, I don't think, I would love that if Healstation Foundation disappears one day and there's no need for rural mental health programs run by NGOs and other non-profitable people. But there is a lot of non-profitable work that happens even in urban areas, I would say. So there are a lot of this gap is filled by non-profit organizations. I know people who work in Assam's rural mental health, some people from Madhya Pradesh, like we are working on it. I think I and Bhavna discussed it on one call. There are a lot of people doing things at a lot of places, but that is also because the government is not able to reach them. That is a fact that we can't avoid at this point.
I wanted to add over here, like the public healthcare system still needs a lot of push. So talking and going in the direction of mental health is still a long, I would say, far-sighted dream that we are actually thinking upon. So it is.
But if we look if we want to be a little bit hopeful, since we're talking about mental health, our betterment of our own mental health, we want to be a little bit hopeful. I feel that the program is beautiful. It needs to be executed really well. And I hope now after COVID, I feel that there are a lot of people who want to work in mental health. Like I know a lot of my friends who want to equip themselves with skills and want to help people for the sake of helping. I'm not even saying the sake of profession. So that is the shift that I have been seeing. A lot of people inquire us that whether we can volunteer, and so there is this good shift about people wanting to be associated with mental health work. So I feel that shift is really great, and that also might solve our resource problem as more people will go for, let's say, psychiatry training or psychology training, or even for the basic mental health aid, first aid kind of thing. A lot of people are equipping themselves with that after COVID. So always, I mean, we don't need specialists for everything. That is the core of our program. Like Gaurav has MBBS and then postgraduate diploma in mental health, so he's trained to treat mental health illnesses. And I'm not a psychologist, but I have been provided the training to handle the basic issues of mental health, which in itself is a revolutionary thing, that it changes the model. You will get so many resources like us, then you don't have to say, okay, we are lacking in number of psychiatrists, we're lacking. Obviously, there's a place where psychiatrists have to pitch in. There will be some illnesses which will be beyond our limits, but then there are most which are fitting into our knowledge. We hardly have to refer people as such, to a specialist. So what I'm trying to say is that all these things, even WHO is talking about that, like empowering health workers to have that mental health knowledge, empowering general practitioners to have that kind of knowledge, empowering other people in the community, I'd say community leaders with that kind of knowledge. So I think if we take that bottom up approach, it will be kind of revolutionary rather than coming from a top down approach. So most of the policies come very top down, but I'm so glad because WHO talks about this community mental health model, and there's a lot of talk going on about community mental health models. And one of the models that we also have is a community mental health, rural mental health model, which is based on using health workers, using somebody like non-psychologist person like me, somebody like Gaurav, and bring that change. So I think this kind of approach might solve the problem in future.
Absolutely, yeah. I think it's very real and very true that we have low resources, and task shifting is definitely going to be key to be able to help so many people that are out there. So utilizing all resources that we can get is the answer here until we reach the optimum level and everything is just working in the right flow, which is obviously a long way to go. Okay, so to understand better, how mental illnesses are, the prevalence is there, but what type of mental illnesses are more prevalent? And since Rehab Path is an organization that primarily used to focus on substance abuse and addiction, and now it has gone on to include mental health treatment centers as well. I would love to know, is substance abuse a common problem that you see in rural areas, in the areas that you're working in?
Yes.
It is there. Yeah. So it is there, and I think we have not even started working on it. So how it is that like when we started going to the villages, after some time, there was a rumor about us that we have gone there because we will give them some medicines, and after that they will not have alcohol, or they will not be able to have bhang is quite like it's everywhere all around. So that, so they thought that they started saying that he's a daru chhudwane aaya hai. So early on we decided that to reach there, because part of their culture, they make their own alcohol, and Bihar is a dry state, right? So they make their own alcohol. Women in the houses, they know how to make alcohol, so they make alcohol, freshly prepared alcohol, and everyone consumes. If it's some festival, they offer it to their deity also. So it's part of their culture. And if you are like in my clinics, if I ask them, do you do any kind of nasha? So they would say nothing, no, nothing, just a little bit of tobacco and sometimes alcohol. So it's not like a lot of people do not consider it as a substance that is abused. So I think that is there. But having said that, I think now even the people with all the substances have found a very good market in rural areas. So I have seen people doing all sorts of drugs here. Like you get heroin everywhere around here. And then like recently I heard that there's somebody who comes from Patna and sells cocaine as well. Then other things, all the substances, you get all the substances here. Then there are all the drugs, right? Like all the sleeping pills and all the opioid painkillers. So and there are no regulations. Nobody regulates that, you should give it only through a prescription. Nobody knows also. People selling the drugs, they don't know that, they are not supposed to give it without a prescription. So those things are also there. So like, it's like anywhere else probably now, that you get all kinds of drugs and people are abusing it. And we have not yet found enough courage to still work on it. Yeah.
It's a complicated issue to work. I'm sure, like, because I do not have much exposure in how the business around alcohol goes in cities, it seems very sophisticated, at least from outside. In rural, that doesn't happen. There is a lot of social power equations, political equations around it. So it's hard area to break into for people like us who do not know anything about that. It's a little bit risky that way, and I'm telling you, this is a real challenge that we face. Because we have had discussions about it with the leaders in the community who themselves are abusers of alcohol, plus the police system per se, or the locals there, and kind of. As Gaurav said, it is not seen as there's something wrong in consuming that much alcohol. In itself is an issue. So probably as a first step, only imparting knowledge, at least into the school children, is what I feel is very important. So it was always one of my, I would say, to-do list thing. In school mental health, we do talk about drug abuse and stuff like that. Because that age is such a vulnerable age where you do things because they're cool, and then you get into a trap that you want to get out of, but you can't, after a certain point. Because the family also feds up, like, how much money we should give him, and like, those kind of things. And interestingly, girls do not follow into that trap. Most of the guys do at that age. So I think at least that can be started, like, without getting into too much complication. I think while talking to you, I feel that that area is something, at least giving that education is right. What is substance abuse per se, and what kind of symptoms do you see in yourself when you have crossed the level and it's termed as addiction and as illness, as an addiction. So I think that those kind of things can be done. I think we also lack resources to do that. And if Rehab has good resources, maybe we can collaborate and do that. I don't know. But yeah, it is there. It is very much there. It is very much an issue. I think average, we get a lot of cases in the hospital also of abuse. And parents bring their children as like, he's not listening, and at least you tell him something or give something that will divert him from taking substance. But that this is again a very complex issue to work on, and not a very good success rate. Okay. So that is kind of a difficult area to work in. So I applaud you guys for working on it. Seriously, I find it very difficult to work on it.
No, I think it makes sense, like how you pointed out that it is something that's linked to their culture or sometimes even to their religion, right? When it's something that close to someone, it's very, if someone comes in, points out and says it's wrong, it's obviously very difficult for anyone to accept or listen, and that might hamper the other things that you're doing. So I think it was very smart of you to keep that on the side for now and focus on the other issues. And I think you've also found a very smart solution, is working with schools and children, because at a younger age they would have probably not started using those substances, and educating them about what harmful effects it could have on their bodies can be very helpful. So again, I would like to applaud you for thinking of such innovative solutions to things, and I hope you continue doing this work in schools as well. So given that you've worked for a while in this area, let's say there is some other organization, some other people that are inspired to do something similar. How do you have any tips for them as such to, how can they make themselves more accessible to people in the villages, and make it easier for them to be able to approach them openly?
Okay. So I'll say a few things and then continue. Yeah. So a couple of things. I think one of the barriers that we had when we were working was that we were not accepted, right? And I think that was one of the first things that we faced. And in any community, wherever you go to work, it's almost universally applicable that first you have to gain acceptance there, and then only you can work on anything. So I think, and that is one of the most challenging steps. So I think that is something that you decide that this is what you want to do, this is where you want to do, and then you work on and how do you gain acceptance? You gain acceptance by doing a couple of things, right? Like, for example, first, by being present. That is the first thing. Like, sometimes what happens that, and we have done that mistake, that we started, we went, we did some intervention, we came back, and then we were gone for a couple of days. Like, we were not there in the community. Okay. And then we went back again and we expected that, oh, everything will be fine. It doesn't happen that way. It's a lot of hard work. It looks very nice on Instagram. You should see my Insta. It's really beautiful. But it's a lot of hard work and a lot of frustration, a lot of heartbreak, a lot of things. Okay. So all the not so nice things. But by being there, and then, one of the things I always tell my teammates also, when we go in the community, when we are there, it's our responsibility that we break that power equation between a provider and a receiver. Okay, if we go there as a provider, we become like we are at this pedestal and people are there. So then acceptance becomes again difficult. So you have to break that and you have to bring it down, or at least somewhere near that. So that is something that you have to proactively work on. And third thing is that try and not contradict them on things that they believe in. I think I am extremely mindful of the fact that suppose I went to the village and they don't have to pay a bill as per their meter, right? They pay a fixed amount. So if somebody has left a bulb on, it bothers me a lot, but I never tell them switch it off, because I don't want to contradict, because I want to be liked and loved and accepted. So I think that is a conscious decision that we take, that, okay, fine, no, I am not asking them to switch it off. Someday they will learn, and someday probably I'll be able to tell them, but not today. So I think that is something that when you start, that's a big challenge. So I think this works. This tip really helps, that you have to be there. People will not accept you. You have to keep going back, and you have to keep being like them, so they'll like you. Yeah. Snehal, you can tell other things.
Yeah.
Yeah.
I think good that we both are invited here to talk about our experience and our work. But I feel the real work is done by the team on ground. So we have this amazing group of girls, very young girls. Some of them are graduates, some of them are 12th passed, some of them are married, some of them are not, And first when they came, that they just knew that they have to do a survey that I'm teaching about them. When we talked about mental health and we started giving training about mental health, 30% of them dropped out. Then when they started doing survey, they started getting, what kind of questions are you asking? These are such weird questions. You are asking, somebody's talking to themselves, laughing to themselves in the house. And people were really offended sometimes with those questions we were asking, and they had a hard time during survey. They used to come and as like complain to me, ma'am, doing this survey is not this and that. And then some girls dropped out in that. So we started with around 40 girls. Now we have team of like 15, 20. So number dropped there. And then after survey happened on the first day of our clinic, out of 65 or 63 people were supposed to come, and not even 4 or 5 people came.
Oh,
Yeah. And they had gone to each home twice to call on the day of the clinic, also the day before also. I was like, how come people are not there? Go. And they went twice and they're like, people are not coming, ma'am. We don't know what to do. So, and now it happens that like their patients are like, if anything happens, they are the first point of contacts in the way. The call doesn't come to me. My number is there with a lot of people, but the call doesn't come to me. The call comes to them. Or when after every 10 days, they go to follow. They show up their face in the community. They take the difficult comments, critical comments from people. They are the ones facing it. So I think their patience, their commitment to work, and their, I would say, their hard work. Because I know a person who would go 10 kilometers on a cycle to do one follow-up, but he or she won't say that I won't go because it's 10 kilometers away and it's so hot and it's raining or something like that. They would make sure that they go and they ask the patient. So, also sometimes they slip, but they have this maintain the quality of work that we do. So I think there is a lot to learn from them, how to work in the communities and how to face the situations, because that's how we both have learned. It has been quite reverse. So whenever we have to do something in the community, it's them whom we go to ask, tumko kya lagta hai, ye kar payenge kya hum? Because they then gives our devil's advocate point of view better than we can, because they have lived their whole life in the community. So I think it's important to be inclusive in that way, rather than, as Gaurav said, removing that power equation, not just between a doctor and a patient, but removing that team leader and my team kind of power equation is also very important, because you are naive, because you are working in the community that you haven't lived in. So that is the tip I would give to whoever wants to say, who wants to start such kind of work, that, be a learner and go in the community. Keep an open mind about changing your plans as things go, because it's difficult work, but it's more important to support the team who's going to work on the ground, because they are the real power of this program. And if you want to start, you do not know how to raise funds, how to do this, because we do this by crowdfunding. We don't get any kind of support from government or any other CSR or anything. We do this by crowdfunding. Normal, all of our friends, relatives, our followers on Instagram donate, and we run this program. Never ever ran out of funds till now. So I want to say that these are all learnings are with us. Anybody wants to start, we would love to share. This is not something we want to keep it to ourselves. We really want, if somebody is enthusiastic enough to start with it, we are ready to help them totally.
That's a very sweet offer, and I hope that some people do take it up. I have one last very important question, after which we'll try to wrap up. It's a little bit beyond our scheduled time, but that's okay. We had a very stimulating conversation, and I'm really excited to talk more in person with you guys. Okay, so my last question is, how can people contribute to your organization? How can they volunteer or donate?
Okay.
Yeah, I mean, yes, Gaurav, go ahead.
I'll tell a little bit, then Snehal can continue. So there are a few things, we are almost always in resource crunch. So especially like, for example, I'm the only doctor doing it all here. So I am yet to find some other doctor who can say that, okay, fine, I also want to do this work. But it's not like, it doesn't give you something that you can get in better jobs. So maybe, I don't know what is the reason, but I have not yet found another doctor to do this with me. And so that is something that if somebody wants to donate one day, please come. I'll take them, teach them, show them around and everything. Similarly, that's not the only work, right? We do a lot of therapy sessions, counseling sessions, group therapy sessions, family therapy, all those things we do. And so all those things are there. Like if people want to help, problems are huge. We are this tiny. So I think if people want to contribute in any way with their knowledge and skill, they can do that. If people want to, like there are people who are interested in doing research and writing things, and so we have everything here. You can come, see, interview people, meet them, see the records, and probably you can do some research and write and publish. So we can help you with that also. So that is also there, and so that is one aspect. The other aspect is something that Snehal understands better. The how people can contribute if they want to contribute. So Snehal can talk about that.
Yeah. So as I said that this work is done through crowdfunding, and I mean, for me and Gaurav, it's a pure joy to do this work. That's why we chose this path. And the thing is, we both from our side, I mean, contribute financially as well, but we also contribute a lot of our time to this. And I keep saying to all my friends that great that you guys have corporate jobs, because somebody needs to earn money and donate to the foundation. So to take care of one patient, we need 300 rupees per month. And that cost mostly goes to the health workers who do follow-up, the medicine expenses, and in general, the maintenance. So, the maintenance of the vehicle that we use, and those kind of small. The admin cost is very low. It mostly goes into the medicines and health workers' salary or their cost of follow-up, kind of, who are again all women in our team. It's all women team that we have. So rupees 300 to take care of one patient. It is kind of, we say that 1 cup of tea you have to donate every day, 10 rupees. And you can take care of one person. And I have seen this trend, people who themselves have gone through mental health issues, or somebody at their home has a lot of empathy, and they usually would donate for this cause. So we have 3 other causes to donate, which is menstrual hygiene, digital education, and the tailoring institute. So I am up for all kind of like donate for the cause that you relate to the most, is always, because then you are going to draw more joy out of it by looking at the results. So we are a very small organization and we run on crowdfunding. So I would request everybody that adopt patients so that we can expand the program a little bit. We can accommodate more patients that way, and we have capacity to do that. So if anybody wants to, I can share the details. We have a great Instagram page managed by Gaurav, Healstation Foundation. And we are also there on Facebook. We also have a website, healstation.org. So all that is there. Just Google Healstation, spell it HEAL. You'll get the information. And then I will let you know how to donate. And thank you for this opportunity.
Thank you so much for sharing that. I think I will definitely donate, and I hope that a lot of other people who might be listening will also donate and volunteer in any other way. Like there are so many options, like Gaurav said. So I'm really excited. I will definitely be in touch with both of you. And thank you so much for giving your time for this and talking to us today. It was really amazing. I will hand this over to Bhavna now.
Yeah, this was really, really very insightful. And I would say one of the very less talked about, like rural health for the first time. I mean, just getting to know through you is brilliant. And I am sure a lot of people are going to be listening from our network, and it would be helpful to everyone. So we have already overshot the time, and I'm sure this conversation could have gone ahead. But I know everyone has their own time schedules, and also we are going to hit 8 in some time. So, any ending note that you want to leave our audience with? I mean, since you have actually shared all the details regarding if anyone wants to associate with you guys, but still, if there is anything if you want to share, I mean, you can share before we actually close this webinar.
I just really want to say thank you to Nandini for asking amazing questions so that we could give some detailed answers and not cutting a short when we are speaking our mind. So thank you for conducting it so well. And thank you, Bhavna, for arranging this. I think like the first step towards making mental health scenario in India better is to talk about mental health more and more, and talk about every community that we can talk about, be it rural, be it LGBTQ, be it any other community. We need to talk more and more about it to be inclusive, taking everybody with us, because mental health is for all. So just want to leave our audience with one note that mental illnesses are real. And if you see a little bit of doubt in your mind, whether you are suffering from anything or somebody around you is suffering from anything, please feel free to reach to us. We don't take money for it. It's our passion, so we do it. So anybody who is thinking, I do not know where I want to go, please come to us, because we have done that. So if you just drop a message on Instagram, Facebook, at our email ID, we do respond and we do help. So I want to tell anybody out there who is thinking that I might need help, but I do not know where to go, please come to us. Please don't hesitate to contact.
Thank you so much, Snehal. So, I mean, it was great to have you both today, and thank you for the participation. And we are going to be back with another webinar. And till then, stay safe and have great Durga Puja festival ahead. Bye. Good night.
Thank you. Bye-bye.